In this simulation, healthcare team members will learn what motivational interviewing is, how it works, and what benefits it can bring for patients and the care team. Their virtual coaches, Eva Lewis and Dr. Bob Schwartz, guide them through the simulation and provide feedback throughout. The simulation takes around 45 minutes to complete. Healthcare team members will learn about a variety of patient-centered communication approaches. Each conversation focuses on a different set of MI techniques that team members practice with virtual patients. The first conversation focuses on the value of using patient-centered language to avoid provoking defensiveness, elicit patients' reasons for change, and strengthen their motivation. Healthcare team members will learn about 3 MI techniques: asking open-ended questions, reflecting patient statements, and sharing information with elicit, provide, elicit. They will play the role of a medical assistant with health coaching responsibilities in a well visit as she talks with a family. They will get a chance to practice MI approaches as they try to build motivation for the patient to change his soda drinking habits. The second conversation focuses on why patients find voicing their own reasons for change more motivating than hearing other people's arguments, and how they can reflect patients' change talk to strengthen motivation. Team members will learn about 3 different types of reflections: simple reflections, complex reflections, and action reflections. They will practice these skills by taking on the role of a nurse with health coaching responsibilities and helping a mother think through her choice to stop breastfeeding, using reflections to highlight her reasons to continue breastfeeding. The third conversation focuses on the counterpart of change talk statements called sustain talk. Members of the team will learn how to best respond to sustain talk and keep the conversation going using 3 MI techniques: offering double-sided reflections, affirming patients' efforts and intentions, and reframing obstacles as solutions. They will practice these skills by taking on the role of a nurse practitioner health coach as she talks with a patient and her father about changing habits around snacking. There are a lot of ways for team members to receive feedback on their choices and reinforce learning MI skills. Throughout each conversation, members of the health team receive in-the-moment feedback from their virtual coach on choices they make. This helps reinforce the connection between the skills they're using and the outcomes those approaches have on patients. At any point in a conversation, team members can click Undo to take back the dialogue selection they made and try a different approach. The meter measures the patient's level of engagement or willingness to change as the conversation progresses. The meter changes based on the dialogue choices selected. This shows members of the team the immediate impact of their choices and provides insight into how the patient is feeling. Thought bubbles allow team members to listen to the patient's thoughts. Paired with the meter, this gives team members direct feedback on how the dialogue option selected impacted the patient. This promotes empathy and aids in developing emotional intelligence. Healthcare team members can review the patient chart and any relevant information at any point throughout the conversation. At the end of each conversation, team members view a detailed analysis of their performance, how well they did in achieving their goals, and ways to improve in the future.